Normally in party politics, a party comes up with a proposal and immediately, normally within a matter of minutes these days, the proposal is rubbished before it's been read by their political opponents. The party politics of the imperative of greater integration between health and social care is slightly different. Every time somebody refers to the Burnham Plan for greater integration between health and social care, I tend to pop up and say, actually, it was the Health Select Committee that got there first, and out of respect and politeness to Andrew Lansley, I point out that the health and wellbeing boards around which the Burnham policy is, I think, being developed were created not by Andy Burnham, nor even by Stephen Dorrell and the Health Select Committee, but by Andrew Lansley and the Health and Social Care Act, which is, I think, an illustration of the law of unintended consequences, the evolution of institutional integration through the Health and Wellbeing Board is, in my view, one of the opportunities which the institutional arrangements which now prevail in health and social care creates. The real challenge, if we want to convert the words about integration into a service that is in truth more integrated on the ground, is to think about which institutions that currently exist on the ground can be developed in a way that furthers that policy objective, and which ones need to be redirected slightly to contribute to that broader purpose, which is why from the Health Select Committee we have made the case for greater integration for all the reasons that are familiar to everybody in this room, and we've also pinpointed the Health and Wellbeing Boards are certainly not delivery agents in their current form or in the short term for greater integration, but the place at which I would start, because they are the institutions in the system that bring together in the same room health and social care. Can I pick up one of the other themes that struck me? Do we need to redefine the definition of what we mean by health and social care? I always think that it's important when thinking about that question to remember there are no Rubicons here. Over a 30-year period, the boundary between health and social care has already changed fundamentally. Elderly care used to be a service that for the majority of people was called geriatric care in the health service. It was delivered to a poor standard, but it was free. Overwhelmingly, that service, responsibility for delivering care to those people, has been transferred by party political consent over 30 years out of the free healthcare system into the means-tested social care system. In other words, the boundary between the two systems has already been moved, which is why, when you think about it, it's become increasingly sensitive. Instead of being a boundary that did mark some kind of common sense division, it no longer does mark a common sense division. It actually divides two bits of a service that need, if we're going to deliver the objective for the elderly individual, that need to be experienced by them as a single service. And therein lies the core of the problem. The one thing that we have to address in the health and social care system is, in addition to all the opportunities opened by clinical technologies and treatment techniques and ideas about what care should look like and so forth, is the role that information technology needs to play in reshaping health and social care systems. As I very often say, delivery of health and social care is just another form of economic activity. It is 10% of the UK economy. If you think around the rest of the 90% of the UK economy, how has every other form of economic activity changed beyond recognition in the last 30 years? It's been reshaped by the ability of computers to exchange and deliver information in a way that was simply undreamt of 30 years ago. We simply haven't begun to think through what are the implications of real interchange of information between the different parts of the system. And when we start to think that through, that will even further underline, if it needs any further underlining, the nonsense of trying to deliver care to a single, often confused elderly person's front doorstep from uncoordinated bureaucracies that don't even share the information between themselves about what the needs are of that single, slightly confused individual living at home. That's a challenge we all talk about, and I really do welcome the fact that the Barker Commission has taken on the not inconsiderable task of telling us how to do it.